This campaign is based on the 4 E's. The first E is economic equity. And there are 2 major issues that we think need to be fixed. First of all, there has to be universal health care. The only approach that makes sense is a single-payer system. We're the richest country in the world. The WHO, the WHO, do you know how they rank us? 37. They rank France #1. Look, it's not that the Mayo Clinic or Dartmouth or UVM don't have great care. They do, as long as you have insurance to get to it. Obviously, from a moral point of view, I do believe that all humans deserve health care, very much like other sort of inalienable rights. Because you have a multi-payer system, you're wasting all this money on going back and forth with insurance companies. The technical words people use are risk selection and denial management. What that means is that insurance companies, they're spending why are there big skyscrapers full of people in insurance companies working? The reason you have skyscrapers is all these people are sifting through your records to try to, I mean, you as a doctor would know, sifting through your records to say, he's a risk or she's a risk. I don't want them to be in my policy, I'm going to keep them out. Because the most efficient way to do all those things, at least those 2 big priorities, is Medicare. And it works beautifully. I mean, I'm not saying there's no problems with Medicare. Everything's messed up in some ways. But the fact is, people who are 65 and older, in general, have reasonably good health care. And they have someone who takes care of it. Now, this is not socialized medicine. What it is socialized insurance. If you have Medicare, you can go to your own doctor, you can go to your own hospital, you can pick your treatment. It's not like the government picks that. All the government does is writes the check for the bill. And if that seems to kind of work for 65-year-olds, it doesn't make sense to say it doesn't work for 64 or 61 and 60 and 59-year-olds and much younger. And the final point is the proof is in the pudding. The fact of the matter is that Medicare is much, much, much cheaper and gives better care. And the reason is very simple, because their administrative costs, there are a few reasons, but the biggest one is that their administrative costs are tiny, because they're not spending all this energy trying to keep you out of their health insurance or all these doctor's offices. I mean, when you go to a doctor, why do you think there's like 10, they tend to be more females than males, but why are there 10 or 12, I'll use the word women, in the front of the office doing all different things? They're not doing anything that helps you in terms of health care. They're not making you better. What they're doing is dealing with all this in 12, 20, 30 companies, insurance companies. And your doctor is going crazy. He's spending half of his day doing the same thing. So it's 2% for Medicare administrative costs. It's 15% for private industry. Because Medicare, if you're eligible, they write a check. The health insurance companies, if they get a bill, they spend all their time trying not to write the check. And if they're going to write the check, to delay writing the check in the first place by denying it. They know the doctors. They deny it automatically. Insurance companies are very efficient and good at their paperwork. The problem is they do too much of it. Right. But if the government has a contract with them to administer Medicare, which is what they do now in many states, that would be just fine, because they're not making decisions that affect your health care based on profit. They're just following the instructions of Medicare.
What the doctors told them to do.
What the doctor told them to do. Good. Now, people look at this sometimes and say, oh, is that socialized medicine? It's not socialized medicine. It's just health insurance by the government. You still get to go to your own doctor. You still get to choose your own doctor. But the cost savings are enormous. I think a country is judged by their health care. And if you are insensitive enough that you're willing to have a significant percentage of your population not be insured, I think that's a problem, but it's easily rectifiable. And I think that if you have definitive leadership, then you say we need a single-payer system, that's the right thing to do, and you don't compromise on that. There are things you compromise, but there are some things that you simply don't because they're right.